Hello, everyone, and welcome to Iowa Ideas In-Depth Week. This week's focus is on the urban-rural divide, and the name of today's session is Maintaining Services in Rural Areas. I want to take a brief moment at the top to thank our sponsors. The Iowa Ideas presenting sponsor this year is ITC Midwest. Hello, everyone. My name is Aaron Murphy. I am the Des Moines Bureau Chief for the Gazette and the moderator of today's panel discussion. We have three great panelists with us today, each with their unique expertise that they will bring to this discussion. And I'll go around the horn here and have everybody introduce themselves and tell us real quickly their position and a little bit about their organization. So Mike Kennan, let's start with you.
Hello, my name is Mike Kennan. I am the Cass County Emergency Management Coordinator and the 911 Director out of Atlantic, Iowa.
Very good. Thank you, Mike. Matt Wietrich, we'll have you go next.
Hi, everyone. My name's Matt, and I am the Executive Director for Jefferson Matters in Jefferson, Iowa, which is a Main Street and Chamber organization.
All right. And finally with us is Brent Willett, who is, I'm sorry, go ahead, Brent. I almost stole your line. Go ahead and tell us about yourself.
Hey, Aaron. My name is Brent Willett. I'm the president and CEO of the Iowa Healthcare Association. We are a statewide trade association that supports providers of long-term care services and supports all over the state.
All right. Thank you all very much for being here for what I know is going to be an interesting discussion. We have a number of topics that we got planned for you all to go through, but wanted to remind our audience members that they can submit questions in the Q&A at the bottom. And if we have a chance, we'll get to some of those with our panelists here today as well. So I wanted to start. So again, the title of today's session, Maintaining Services in Rural Areas. And so I wanted to start by just kind of getting a lay of the land for each of our panelists, industries and areas of expertise and the challenges that they face in that arena. So let's go right back in that same order. Mike Kennan, and starting with you, I hear often about the need for emergency services workers in communities, EMTs, ambulance drivers. How pressing is the need out there for those kind of folks right now?
There's a lot of need, and it goes the gamut. Of course, there's EMS people we're looking for, but also fire departments. Everyone's getting older on fire departments. There's a real difficult time getting younger folks to volunteer, be a part of a community. Law enforcement, as you might imagine, everywhere is a challenge. I have trouble in my world. I'm a 911 director. We're fortunate here right now, but there's lots of places. Dispatchers are really hard to come by, especially good ones. But EMS, I presume EMS is kind of why I've been asked to be on this panel a little bit, because I've been involved in that lately. But we have a private countywide service that we depend on here. It's so we have a patchwork. We have this private countywide service that is basically a partnership between the city of Atlantic, the county of Cass County, and our hospital that subsidizes this countywide service. The rest is a patchwork of volunteer services in the smaller towns out and around the county. It gets very difficult, especially at certain times of the day. People live in Massena, but they don't work there. So you might get a call and those people that maybe would work, and answer calls in an evening are working at the hospital, for instance, maybe during the day. And that service, while that ambulance is maybe sitting there in Massena, there's nobody there to drive the ambulance or be an EMT or a paramedic on that ambulance. So those are and that's 30 miles away. So every call that we have in our county, we're sending this countywide service out, but it's 30 miles away. So those are real challenges that we have.
Yeah, and that I was going to ask you, and you started to talk about it a little bit right there. Again, as we think of maintaining services in rural areas as the theme here today, tell us a little bit more about that, Mike. Is there a danger of having communities out there that either don't have those services, or they're not, like you mentioned, they're not as readily available or as close by as maybe you would ideally like them to be? Is that a threat out there?
Yeah, sure it is. If you don't have people that are trained to do what what needs to be done, you don't have that service. We have tried to come up with a different. We have a program right now that it's a pilot program for EMS. We will equip volunteers out in our rural areas. They may be someone who maybe they're a nurse that they and they work different hours and so forth, but they bring this. They have a pack of that includes an AED, stop the bleed kits, some Narcan, and they can take this pack and be notified of an incident. Say they live in Massena, 30 miles away. They can get to this, a person that has fallen or has a severe, cut on a leg that's bleeding. They can get a tourniquet on somebody, stabilize that person until an ambulance can get there. Because even in our volunteer services, they may be a farmer that works, is working out in the field. They have to get to a vehicle, get to town, get that ambulance to where it needs to go, and that all that is time, and it's it can be critical. We try to do it. We're trying to do what we can to lessen that time and stabilize people.
All right, and I want to talk a little bit more about that pilot program. We'll come back to that, but want to bring Brent Willett in now. And Brent, I know from talking to folks in the industry that there had already been a kind of a growing need for more senior healthcare workers before the pandemic, and then that became even more pronounced during the pandemic. That was obviously a challenge to your industry. Now that we're sort of on our way out of emerging from the pandemic, what's the landscape look like right now? What are the challenges facing nursing homes and senior care facilities?
Sure. Thanks, Aaron. So, this has been, and it's, you've covered this really, really well over the last few years. We've seen a major contraction of access to long-term care. And when I say long-term care, really the care continuum, everything post-acute or after the hospital, from home-based care to assisted living, community care, and all the way up to nursing facility level of care. In Iowa, since 2020, we've seen 29 nursing homes close, and that has resulted in a removal of access of about 3,500 beds around the state, disproportionately affecting rural communities, and the primary, almost solitary driver of those closures has been availability of qualified workforce. So certainly, another side of the coin from a lot of the things that Mike was talking about. When COVID really removed about 12% of the workforce from long-term care in Iowa, meaning we had 12% of the workforce went away and has not come back. Virtually every sector of the economy, it would be extraordinarily distressed by that kind of flight of workforce. And when we factor in that has disproportionately affected rural communities, that's created a really serious situation. Now, what's really important, I think that, to state the obvious, I was thinking about when Mike was talking about the fact that you've got local volunteer responders who have other jobs, who might be working in a field and has to reach a vehicle and make it to the emergency. We've come to expect in our state, growing up and living here for many years, we've come to expect that when and if we need long-term care service, we're going to be able to receive that care in our local community or darn near to it. That infrastructure has never been more challenged and more fragile at this point, and for a lot of the reasons that I pointed to. What we know is that a growing number of Iowans, look, Iowa is the fastest aging state in the country. We know the demand for long-term care services in rural parts of the state are going to grow by 35% over the next 10 years. And so and we also know the other data point is that a growing number of the individuals who need long-term care supports and services are unable to pay for it, and therefore they're on Medicaid. A lot of Iowans don't know and haven't had to understand this, but Medicare and traditional health insurance does not cover the cost of long-term care stay here, and so more and more folks are on Medicaid. Now, I certainly commend the Iowa legislature and Governor Reynolds, who have been a champion for funding Medicaid for long-term care supports and services for a long time, and they stepped up again this year. But unfortunately, the problem continues to perpetuate and costs continue to grow. So we need to work to innovate together with the state of Iowa, with our partners, to figure out the best way to deliver long-term care services in the most efficiently, economically, and quality care level of care possible. And there's a number of really cool things going on around the state that I'd love to talk about. But certainly the situation on the ground calls for a major change in the way that we deliver care to ensure that we can meet that contract that we've all grown up to expect, which is when I need long-term care, I'm not going to have to jump the county line, or I'm not going to have to live miles and miles and miles away from my family.
And that, again, real quick before we move on to Matt, Brent, I wanted to ask you, and I think you started to answer there, when you talk about the number of closures we've seen and the number, that means that many fewer beds in the state. What's the impact of that? Like, what does that tangibly look like when those things happen, and what additional challenges does that create for folks and families who need these places?
So the most acute challenge is felt by the residents of those facilities when they close. The terminology, the medical terminology of transfer trauma is a really real thing. You got to remember that folks that are residing in nursing homes are the most fragile and medically fragile and elderly population that we have in Iowa. To meet the standard of nursing facility level of care these days, you're really sick, really fragile. So finding safe placement and actually executing the transfer, physically producing the transfer, is one of the biggest challenges to keep those folks safe. And what we know is that with these facilities that are closing in rural Iowa, the transfers are farther and farther away, because this is a self-perpetuating challenge. As beds consolidate, there are fewer open beds in more adjacent facilities closer to the affected facility. Therefore, Iowans are having to be transferred farther away, which introduces that immediate physical transfer trauma issue, but it also introduces extraordinary challenges within family dynamics. And one other thing I'll say is that we know, I mean, there was an article, I believe yesterday, in the New York Times that unpacked what the impact of a removal of access to loved ones during the COVID lockdowns. It had such a material impact on the mental and physical health of residents that we unfortunately face a version of that when we're forced to move these residents farther and farther away from their home communities.
All right, and we'll come back to you, Brent, to talk about some of those programs that you were talking about. I want to bring in Matt Wietrich now. Matt, when we think about small communities and that are seeing population loss, one of the natural things we think about are the small businesses in those towns. What is you work in, in a sort of chamber of commerce type of nonprofit organization? What's the landscape like right now for those small businesses in Iowa's small rural towns, and what kind of challenges do they face?
Sure. That's a good question. Well, from what I see here locally, you see a lot of scrappiness. I mean, folks are very creative. They're very dedicated. I mean, if you're a local business owner, you are, it's never been for the faint of heart, but as we have seen, it's continuing to be more and more challenging. And with the Amazons and all the online ordering that can be done adds a lot of challenges as well on top of everything else. And the pandemic just exacerbated not wanting to be around people or shopping in person. And some people discovered some new conveniences in life through that as well. So there's been some adjustments to that, but I think that people, so our town, for folks who don't know Jefferson, is about 4,500. Our entire county is just under 9,000. So we are very rural, very small. And we kind of lean into the idea of, we don't have a Target here. We don't have a Best Buy here. This is not why people come to Jefferson. They don't come looking for resources like that. But you lean into some of those, the placemaking things we really lean into well. And that's part of the Main Street Iowa program. And I'll probably hit on Main Street Iowa a few times a day and be a big advocate for communities becoming Main Street organizations, or communities, I should say. There's a lot of great structure that comes with it, a lot of stability, plans. And there's a lot of things that can be done that as far as working together, realizing that when one person does well, everyone does well. And I think we see that here locally. That's a benefit of small town. We have a lot of partnerships, a lot of people with local buy-in, a higher percentage probably of our community teams up together with projects and supporting one another, supporting businesses. And that's one of the things here, and I know in our area that we are really proud of, and we reference a lot on our successes is our partnerships, whether it's private, public, nonprofit, whatever it may be. And so there's a lot of that collaborative energy that goes on in, I think, any of these small towns, and certainly the small businesses are part of that equation.
Yeah, and let's use that to move on now to stories of success or programs that may be giving you folks optimism about facing some of these challenges. And we'll sort of do the boomerang thing here, and Matt, stay with you and circle back. You were starting to touch on some of the good things that are happening in your community in Jefferson. Kind of expand on that a little bit more, and I believe if my notes are correct, among the elements of what's happening is a state economic development program that's also helping out. Tell us a little bit more about all that. Yeah,
there's a few different things. The Iowa Great Places program is something that has been going on for a bit. It now, as it just recently exists, only essentially in name and spirit. The funding is not there for it at this point. Hopefully it'll come back. But perhaps in lieu of that, they started a new program called Iowa Thriving Communities. And this year they had 37 communities applied to be that, cut it down to 20, went to Des Moines to do a pitch to a panel through the IEDA. And they picked 11 communities. And so the Iowa Thriving Communities designation is a way to acknowledge communities that are getting creative with housing and figuring out the housing situation, which has been, I should say, I'm also on city council here. So our city's top priority and our county's top priority has been housing for quite a while. I'm sure it is in every rural community across the state. So the Iowa Thriving Communities program helps you score a lot higher on housing tax credit programs, which can be the swing factor on whether a development happens or not, to get rental or single family or whatever it may be developments going on, which is huge. In our county, we have about 30% of our workforce lives outside of the county. So that's certainly an issue, and we're hoping to kind of slow that trend down. And that can make a difference in the local economy when a large percentage of folks are taking their paychecks to spend them elsewhere. So the Iowa Thriving Communities program is new, and we'll see where it goes from here. It'll be one of those, they want to be able to send communities to the designated communities to look for examples and inspiration, and we've been doing that for a few years on some of our other programs and projects. So we're proud of that, to answer questions and host people that visit to see how you guys doing this in Jefferson? What's going on? And so we're happy to kind of pivot that into the housing realm right now, and all those partnerships I mentioned is really digging in deeper on creating or solving this problem that's it's evident because everyone's flocking to the bigger communities and the suburbs right now. So we're working on reversing that trend right now.
And are there any tangible things that you've been able to see, some encouraging signs?
Yeah, there's a couple of locally, we've have a couple of developments that are just getting underway, some agreements literally this week that are falling into place. And we feel like we're kind of starting to stick the landing on some of these proposals that have been talked about for years, and now we're able to kind of see them come to fruition. So working with our local economic development corporation, with city, with employers, and how they're creative and wanting to contribute to, it financially benefits them to be able to help have their employees find housing. So again, it's that like communication, that partnership, and everyone coming to the table with the greater good in mind, and not just themselves, their business, their entity, whatever it may be.
All righty. Before we get to Mike next, I just wanted to send a reminder to the folks tuning in. First of all, thank you for being here. You can submit questions if you'd like in the chat, and those will be sent to us, and we'll get to as many of those as we can eventually here in the session. And I do see some popping in, and some good questions already, so that's great. And feel free to send in more, and we'll do our best to get to them. Mike Kennon, Cass County has been working with an EMS and first aid pilot program, I believe. If you could tell us a little bit more about that.
Well, this program, like I say, it'll put equipment that will help stabilize a patient, that they can get to somebody quicker than an ambulance could. This program has a technical side of it that will notify through our CAD system, computer-aided dispatch, at the county level, and it will notify them on their smartphone, and they will let us know if they can respond. So the 5 closest people that may be to an incident, it'll notify them. They will let us know, if they can respond or if they can't. So we'll know who we have on the way, and so they can get there, hopefully stabilize that person, and until that ambulance service can get there.
I'm curious, Mike, is there anything in the area of recruitment, any creative solutions, or anything that counties or communities have tried to try and connect with people and get them interested in and willing to be emergency responders?
Yeah, and really that was a lot of the reason for kind of optimism for this program. People that have seen it, that's the first thing they say is this is maybe a great tool to get somebody they don't want to, it's an involved process to get EMT certified, paramedic certified. Those are big steps, and if we can get and you're not you don't have to do those things. Very little training to get CPR and AED and tourniquet and Narcan training. Those are simple things that basically anyone can do if they have the proper equipment to do it. So that's the whole thought process here is maybe we can get some people involved, even to the get them into the fire department, get them into EMS, get them involved and get them young so we can develop somebody here locally.
All right. And Brent Willett, I know there are some encouraging signs, some success stories in long-term care as well, including, I believe, some programs that partner with local educational institutions, high schools, community colleges, to guide young people into that field. Is that right?
Yeah. I'll point out too quickly, Aaron. I mean, the broad picture here is that we need more workforce up and down the healthcare spectrum, specifically in rural communities, more certified nurse aides, both in hospitals, clinics, and in long-term care facilities is a critical challenge that we have. And so we need to be doing in our state, we need to be looking at policy prescriptions to make training and testing more reliable, more quick, and help move folks through the qualification ladder more quickly. That's a different subject. Where you see communities taking this into their own hands. I'll give you one example. In Charles City, North Central Iowa, there's a cluster of long-term care facilities that work very closely with the local high school and community college on a CNA program that helps high school students receive credit, as well as work within long-term care facilities to generate the necessary skills to eventually test and become a certified nurse aide and begin that process. We all know that our best registered nurses and our best LPNs all start as CNAs. So getting those folks in, that's a really nice innovative program that's really been in place for more than 20 years. They've been doing this a long time. More recently, the governor's apprenticeship priorities and programs have awarded a number of grant programs to Iowa long-term care facilities that are focused on moving folks through the CNA pipeline in more innovative ways, getting them more practical skills more quickly. And Iowa is what's called a compact state, which means that if you can demonstrate competency in clinical competency to a licensed nurse for the CNA program, you can take the test and be licensed to provide care more quickly. And that's a critical piece of programming that we have in our state that needs to continue. But the governor's apprenticeship program, Western Home Communities in Cedar Falls, Bethany Life in Story City, both received significant grants that are putting CNAs on the floor and helping to, in Western Home Communities, specific example, focused on helping to train and educate first generation immigrants to work in long-term care. So certainly some really cool ideas. We're anxious to see how these programs sort out and then work with policymakers up and down the spectrum to systemize those across the state.
Yeah, and
Hey.
to that, I'm sorry.
So I was just gonna say, sorry, Aaron. I was just gonna add to what Brent was saying. In Jefferson, we just had a new high school open a couple of years ago. With it, a career academy through Iowa Central, and they certainly have seen a nice success in their CNA and their nursing program for high school kids. And in fact, I have a daughter heading to that program who already has a number of credits done in high school. And so I think what Brent's saying, working with your local community college or encouraging them if they haven't explored this thread yet is awesome. A really great resource in Iowa is the community colleges, and they keep growing their opportunities, it seems like.
Very good. And I was just going to ask, so there's one example, Brent, maybe it's a little early in some of these programs, but have those facilities seen a benefit from that early on here?
It is early. I think that the use case is still remain to be seen. We've encountered some challenges in we've got rules and regulations around the training and testing of certified nurse aides that hasn't been looked at in decades and doesn't particularly comport with today's technology and the demands of the workforce today. So it's been a little bit of a challenge to make sure that those programs can move as quickly as they're designed to move. But we'll get there on that. I ultimately, it does remain to be seen how successful these are, but I would posit a high degree of confidence that these are going to prove to be nice models if we can find ways to, again, to work with policymakers and systemize these across the state.
Well, I got to tell you, Brent, when I hear you describe the kind of rules and regulations that have been in place for a long time need to be addressed, for folks who may not know me, my day job is covering the state government and state legislature. That sounds like a bill coming. The alarms are going off my head. Is that something you'd like to see state lawmakers look at maybe as soon as next January?
Look, legislative action is the last resort for anything. I think there's a great opportunity to really dive into what the code says, how it's interpreted by regulators, and just make sure that everybody's on the same page about intent. And then certainly reserve the opportunity. The legislature has shown a great appetite for getting things right. If we just need to modernize language without an overhaul, I think that's certainly on the table. But I think that there's a lot we can do to just get together and make sure that interpretation is aligned with the current state of affairs.
Very good. And one more thing for you, Brent, real quick, and then we're going to go to some questions that are in the chat. But I wanted to give you an opportunity to address this because I know you hear this a lot when this topic comes up about the specific workforce needs in long-term care, and then inevitably the discussion of pay comes around. From your viewpoint, are those workers paid sufficiently in Iowa, and where's the room is there room for growth there, and what's the balancing act that has to be played there?
Absolutely. I don't think there's enough money in the world to pay long-term care healthcare workers for their worth. So that's a long way of saying that no, they're not paid enough. And I think that we've seen significant strides recently, and that's directly indexed to the government-sponsored funding sources that cover the vast majority of long-term care healthcare for folks. So without throwing a lot of numbers around, about 70% of the revenue that is received by a long-term care facility is derived from about 3 government programs, primarily Medicare and Medicaid. And just coincidentally, about 70% of the cost of operating a long-term care facility or community is used for labor, for payroll and benefits. So as rates raise for Medicare and Medicaid, and both of those things have happened in 2023, wages raise. We've seen CNA wage rates increase from about $16 just 2 years ago on average in Iowa to more than $20 an hour today. We still have room to grow, but that's a direct reflection of the increase in Medicare and Medicaid rates. Long-term care facilities operate today and have historically operated at a loss. And so when we say that 7 out of 10 of those dollars are going to payroll and benefits, every single dollar possible, especially in as tight a workforce situation as we have. I think our providers are doing everything they can to pay as much as they possibly can. But as those dollars come via those programs, wages tend to follow. And so we certainly have a long way to go. This is incredibly difficult work. Anybody that worked in long-term care through the pandemic and is still here, that's a special person. They need to be paid adequately, but to say the very least. And we also need to recognize them for the commitments that they've made. Last point I'll make, Aaron, is that we saw a major flight of dollars that could have gone directly to long-term care workers that instead during the pandemic went to temporary staffing agency margins. That has declined significantly. So staffing agencies really took a ride on the pandemic and created incredible wage inflation overall. The unfortunate part was that those inflated wages, in most parts, did not reach the folks that were working for agencies. A lot of those dollars went directly to those agencies themselves. The Iowa legislature passed common sense legislation in 2022 to regulate staffing agencies. And as a result, we've seen a decline in the utilization of staffing agency labor in long-term care in Iowa by 25% in a year. So that's certainly going in the right direction. That frees up more dollars for wages and benefits.
All right, good stuff. Appreciate everybody and great discussion so far as I expected. I want to move on to some questions now that we're getting from the folks watching. And again, we thank you all for watching and remind you, if you missed it before, that you can feel free to drop a question in the chat here and that'll get passed along to us and we'll get to as many of these as we can. So this first one is from, I believe I would pronounce this Renee. I apologize if that's wrong. And I believe this is for Mike Kennan with Cass County. The question from Renee, Mike, is, are there any thoughts of relaxing the requirements for EMTs? And Renee says she was an EMT, but let her certification go. She would love to help out again, but has been told that she can't because she would have to take all the classes again. I think you touched about earlier, Mike, how difficult it can be to become, certified
Right.
as some of the EMS workers. In your view, is there room to relax some of the requirements? I mean, I'm sure they're also there for a reason as well.
Yeah, I'm
What's
not
your
sure
thought
I
on
could
that?
really speak in depth to that because I am not, I have no EMS background whatsoever. I have
Yeah.
a lot of respect for those folks. But I think on my side, I think it's more from what I see from people, rather than relaxing the regulations, it's funding that training. Fire departments in volunteer fire departments basically are funding volunteer EMS services to a large extent, at least in our county. I think in some places there's a move to create EMS as an essential service. We are looking at that. It would fund a lot of what we do. It fund our countywide service, or if we there's a lot of angst about our private service that we've had, and we've always had it. Not the same one, but we've always had a private service. The thought process is, they could pull up stakes and disappear, which they kind of, every time we negotiate, there's that threat that's out there. And then there's talk of, we should stand up our own service. Well, you can say that really easily. It's a lot harder to do. A lot of money involved in standing up, one ambulance and having a crew associated with, it's just the money and the logistics it gets to be really, really difficult. Whereas like our private service, if they need somebody, they have folks that are like out in Nebraska, and they can pull them in for, to work, 4 days in a row, and then they go back to Hastings, Nebraska, or wherever. If we would run short of personnel, we're stuck. I mean, we would be, in a difficult situation. So, if we could do something as far as funding through taxation, through EMS as a essential service, we could fund our EMS services on the volunteer side with their equipment, their training, and that would be a lot better situation than what we currently have, for sure.
All right. Thanks, Mike and Renee. Thank you for the question. Our next one here, I believe, is most likely for Brent. This comes from Kristen. Are you seeing gaps of disability services in your communities? And is the issue staffing, tools and resources, or a combination of all the above?
That's a great question. There's certainly the availability, and I would maybe extend the definition of disability services to home and community-based services. That's reaching and providing healthcare and service to folks as close to home as possible. That's everyone's first priority. In Iowa, we do have a ways to go to build out our home and community-based service. The good news is that the Director of Health and Human Services under Director Kelly Garcia has made that a top cabinet level priority across the state, and is at work working with organizations like ours, with advocacy organizations and stakeholders and Iowans across the state to build a plan to extend services in a much more robust way. And you're absolutely right. This comes down to funding services. It's about priorities, and it does come down to labor. One of the challenges with the delivery of home and community-based services is economies of scale get a bit extended because we're providing more one-on-one patient care, which is what we absolutely want. But we have to find a way to find the bodies and to fund those services. I think there's a lot more to come. We're really excited about the direction of the state's policymaking around HCBS services. We started to see some ideas emerge from the department over the last year, and I think there's a lot more to come. But we do have a ways to go. We survey our members each year, and one of the questions that we ask is, are home and community-based services adequate to care for everyone in the community that you're aware of that needs those services? By a count of more than 9 out of 10 members say at this point that that's not the case. So we've got a ways to go when it comes to capacity building. But I think that there's a lot of momentum around this issue across the policymaking atmosphere in Iowa at the legislative and executive branch.
All right, very good. And thank you for that question, Brittany. The next question is just a real quick one. And Brent, this is for you because I remember you saying this, and I had heard the same thing, same number, but I can't remember the source. Maybe you do off the top of your head. Deanna was curious what the source was for Iowa being having the fastest growing senior population in the country. Do you recall
Sure.
where you got that number, Brent?
Yeah, I believe it's the Census Bureau. The numbers are kind of shocking. In 2022, about 20% of Iowans were 60 years of age or older. By 2030, that number will be closer to 28%, a jump of nearly 30% in 10 years. And the trend line on that in the out years continues to grow. So we are a state which is rapidly aging. Unfortunately, we're gaining in terms of labor force demographics, availability of labor. We're gaining a lot more people that need care, and we're losing people that are going to be physically able to provide that care in terms of age categories. So we have a major demographic challenge on our hands, and that's why I'll just put a mention in. That doesn't mean that we have to simply accept that there's going to be less community-based healthcare in our communities. We don't have to accept that at all. There are numerous steps that we can take today to increase access to things like telemedicine. We learned during the pandemic. It was kind of like how we learned as a result of the pandemic how well that remote work worked. It's actually kind of a miracle how well that worked. We learned that delivery of telemedicine really, really worked, and there had been long-standing opposition or at least immobility at the federal policymaking level to allow for the delivery of telemedicine for more and more medical services. I think we learned a lot during the pandemic, and so that's one component. Legal immigration reform is certainly another component to this. There's really no way to get around that. So there's some things that we need to do, but we absolutely know that we have a demographic time bomb on our hands when it comes to older Iowans needing healthcare. If we simply let that come to be without making changes.
All right. The next question comes from Martin, and I believe this would go back to Mike. And I've heard this sort of debated and discussed as these projects are discussed up again in my day job up at the Iowa Capitol. Martin's question, Mike, is if carbon dioxide pipelines are built in Iowa, how will they impact the needs for emergency service resources, especially obviously as we're talking about here today in rural areas?
We do not have a pipeline slated for Cass County right now, although it goes right along the edge, and we do have an ethanol plant. So I imagine at some point when when and if that occurs, we will have some portion of our county with a pipeline. We have pipeline training and so forth now. Not maybe the same as carbon dioxide. I'll have to learn more about what's going on with carbon dioxide and the dangers that are present there. I imagine they're a lot the same, but fire departments are well versed in dealing with pipelines now. So I imagine it wouldn't be that much of a difference.
So you don't see there's necessarily any kind of increased need or?
A lot depends on, I guess I haven't done a lot of research on those dangers, but there's a lot of dangerous product that goes through pipelines now. So, and so it's just a matter of, knowing what's there and dealing with it. So it's not something, I've been 15 years in emergency management. We've had, we haven't had an incident here. That's not to say it couldn't happen, but there are certainly there's dangers in all kinds of ways you transport product, whether it's in a truck or through pipeline or whatever. So, you deal with what you're dealing with.
Yeah. All right. I want to get this one. This is a really good question. And Matt Wietrich, I'll start with you, but if Mike or Brent, you have anything to add to this, I'd be curious too. Very simply, Kristen asks, what can those of us in larger populated areas do to support rural communities? I love that question because, especially as someone who's here in the Des Moines area, I'm coming to you from my home office in Yankee, and I hear about all the issues facing small town Iowa all the time. What can those of us who live in the state's metro areas do that would be better, that would help out the smaller communities in our state?
They already do to some extent in emergency management. I mean, we have specialty teams that come out of our metro areas. If something catastrophic would occur in the city of Atlantic, for instance, we search and rescue teams come out of Sioux City and Des Moines and that type of thing. We just don't have the ability to deal with everything. And we, hazardous materials, say we had a hazardous material spill of some sort, our hazmat team is our Council Bluffs fire department. We just contract with them on those types of things, because 15 years that I've dealt with this, we've contacted them on a few things, but they've never deployed here. So, I mean, why would we want to maintain a team that you might never deploy? So those are things that are already happening, at least on the emergency management side.
Excellent. Matt Wietrich, how about you as someone who's, wanting to see his small community thrive? What can people in the state's metro areas do to help?
Well, I think when you examine a little bit, at least, why small towns and small counties are shrinking, obviously the change in how farms are ran plays a part of it. We have less farmsteads than we used to, so it takes less people to make farms a success. And so there's been a big evolution in just the rural scene of Iowa as far as that goes. So you have people leaving that don't need to be here for that, smaller families running farms now. But I think, just surfacely visiting, supporting your communities, doing a lot of staycations in Iowa, that's an easy thing, right? But also when you look at, kind of some of the things we're doing as far as Iowa tourism goes, just the impression that Iowa gives to the rest of the country. If you have kids that are looking to move back or where they're going to start raising their own families, yes, we absolutely need policies that financially support some rural initiatives, and that's got to be a part of the equation. But we're also looking at the culture we want to create that people will want to move back to. So those are all things to consider when it comes time to vote, for example. So we need to make a place people want to move to, and that is obviously an hours and days and months and years long conversation to really dive into all of that. But supporting of rural housing, supporting of entrepreneurial efforts, supporting the public arts. Something we're proud of here is public art, and how many people notice that even today in our office, just talking about the visual. Sometimes we forget about the aesthetics component of things and just the feel we provide. So what are we going to do to support the feel, the aesthetic, the culture of wanting to live in a rural place? I mean, there's a trade-off. You don't have everything within 15 minutes of your house in a rural community. But what you have is that understanding of and feeling of it's a fantastic place to raise your kids, and that's safe for them to ride their bike down the street or go to a friend's house, and the neighbors along the way are keeping an eye open for your kids, and it's that little slice of the Hallmark Channel that you have in some of these rural communities that you really lean into and sell that. And but we could go on and on and on about all.
Yeah.
Now, those are a few thoughts off the top of my head.
Yeah, and that's good too, because that also kind of dovetails into the one other question that we have in the chat right now, which is from Brittany again, and it talks about we've had a lot of conversation today about needing trained people, and Brittany points out that Iowa has had a somewhat troubling trend of exporting young people out of the state once they graduate college, and to Matt's point, they're not coming back in as great numbers, and which also kind of plays into the numbers that Brent talked about the aging population and the share of that here in Iowa. So for Matt, maybe since you had kind of started on that, we'll start on that topic. I'll start with you here. How important is that to create a place in a state that and where young people want to stay here? Just how great is that need right now that I assume affects everything we've been talking about today?
It really is big, and like what Brent acknowledged with the aging population, you hear the term the silver tsunami, and that goes for business owners as well too. And not everybody has a great succession plan in place. So you're gonna, locally, I'm thinking of our jewelry store, for example. If he goes here in a few years, decides to be done, is anybody going to randomly step in and take that over? So it's those little things that in each community, and that locally needs to be an effort to, boots on the ground, be working with people to be thinking, future forward, and how the community can be able to continue having these services. But it is definitely a major concern, and we see it here as well. As far as folks aging out of running businesses, needing, and then the housing situation too. Folks are ready to be done maintaining a yard and having to paint their house and all that, and they're ready to shift over to being taken care of in a duplex or something. So that frees up houses, but you also need places for them to move, and so it's a complex equation there. I can't remember exactly what the question was. I'm sorry.
No, you nailed it. You nailed it. And Brent, I assume that's what way back early in the conversation here, we talked about those programs that some long-term care facilities are establishing with local high schools and community college. I assume that that's part of what those programs are designed to get at, right? Is to attract people, not just to the profession, but to the profession here in Iowa. Yeah.
Yeah, absolutely. It's really about exposing young people to what goes on inside these institutions in their local communities. I used to be in economic development. I remember, one of the priorities that we had was helping high school students, not just in healthcare, but find job opportunities, or at least job shadowing opportunities in manufacturing facilities in the community, which they may have had an inaccurate vantage point on exactly what goes on and how technologically capable they are in those facilities. So it's about before the young person is going to inevitably in many cases move away, at least for school or to sow their oats for a while. We want to make sure that they have an understanding strategically for a state like Iowa that does not have oceans and mountains and sunny weather every year, but we offer a different type of value proposition that is much more attractive for folks that are in their 30s and their 40s and their 50s as they start to raise families. We want to make sure that they understand the types of job opportunities that they have when and if they choose to return. So I think that's a big part of it. And in the immediate sense, when we simply have a labor crisis, we are trying to identify individuals that can work today, individuals that can work tomorrow, and string this together day by day.
Yeah, great questions from the chat. Thank you so much, folks. I'm going to go to Mike real quick with that. Give y'all a little heads up, and then after Mike talks, we'll go around the horn and give everyone time to make a closing comment. So if you want to form your thoughts on that now, Mike, how much would a few more young people sticking around Iowa help your industry, help have more opportunities for folks to work in emergency services?
It'd be huge, obviously. A lot of what we see now is, they're third generation folks that have, their grandpa was on the fire department. Now, they're doing it. Some encouraging signs, though, are a lot more women involved throughout, EMS, fire, EMA. There's a lot of EMAs that are women out there. That kind of doubles your workforce as compared to 40 years ago. So I think there's some encouraging signs. We need to get new people that their grandpa didn't do that. We need to get new blood in there for sure. But it seems like this same conversation was had 15 years ago when I was starting in emergency management, and somehow there you find a way, and you make it work. And whether it's some consolidation maybe sometimes is the answer. Some of these really small towns in our county, they just keep dwindling in size, and consolidation is maybe some of the answer to that.
All right, real quick, maybe 30 seconds each. Matt Wietrich, any closing thoughts?
Great conversation. Thank you for doing this. This is excellent. I think in summary, getting in high school kids' head, empowering them to think they have an opportunity in their hometown. Yeah, go off, like Brent said, sow your oats, see the world, get some culture, come back and do that thing in your hometown. So getting them back home to see what that looks like, but empowering them before they leave is great. Silicon Valley and Rocana is in California, and we've worked with them here to try to build this Silicon Prairie here in rural Iowa. So supporting that rural gig initiative cities is a big thing, and that's another opportunity for all the remote working that we can do these days.
All right, thank you. And Brent, we'll let you close us out here.
Look, I'll just dovetail on what I mentioned earlier. We don't have to the numbers. If you pay attention specifically to data and anecdotes, the challenges for rural Iowa can seem to be a bit overwhelming. But we really don't need to accept that fact when it comes to healthcare. As I mentioned, there are a myriad of things that we can do. We just need to catch up our service delivery, and that's going to require a lot of action at the federal level and the state level. But there's a way to do it. There's a roadmap to do it. And the vibrancy of our rural communities is central to who we are in Iowa. That's not going to change for better or for worse. And so as someone who does, live in the metro in an urban area, I know, that the survivability and the vibrancy of rural Iowa is central to, my livelihood and the livelihood of my family and my community as well. So I commend the Gazette for focusing on this particular issue during this conference, and appreciate the invitation to chat.
Well, and we appreciate you all being on. That's going to wrap it up this session. I want to pass along my sincere thanks to our panelists, Mike Kennon, Matt Wiechik, and Brent Willett. A great discussion today. Thank you so much to all of you who joined us. And again, a heartfelt thank you to our Iowa Ideas sponsor, ITC Midwest. Just a quick reminder, be sure to come back tomorrow and join us for tomorrow's session, which is titled New Idea to Action, where our panelists, Deb Brown and Becky McCrae of Save Your Town, will discuss how to build support for and open minds to new ideas. And a quick reminder, all these sessions will eventually be available for replay at iowaideas.com, and also go to that same website to register for the full conference, which is going to take place October 12th and 13th. So check all that out at iowaideas.com. Thank you all again to our panelists, all you viewers. We appreciate you being here.